So I am happy to be here in Birmingham. It is home for me, and so I'm always excited to be in the Magic City. And thank you, Ryan, for the invitation. We have literally been talking about this for a year, and we have had many great conversations just talking about what can we do to improve the lives of the citizens of Alabama. So I'm very excited to be here today. And so I do want to start with, what is the state of mental health in Alabama? Where are we right now? Where do we need to be? And what can we really do to get there? So this is from the State of Mental Health in America 2024. So for all the policy folks who want to dive into the data, this is on the Mental Health America website. It's data that we use every year. It's really one of the most comprehensive reports that compares different states and where we are with the mental health issue. So in Alabama, for adults, we know that we have 587,000 Alabamians who report a substance use disorder. We have 931,000 Alabamians who report a mental illness. Our average is a little higher than the national average. And then we have 2,010 individuals who reported serious thoughts of suicide in 2024. That is also a little higher than the national average as well. And in 2024, we lost 827 adults to suicide in our state. Our percentage ranking, mortality per 100,000 individuals is lower than the national average, but losing one individual in our state to suicide, in my opinion, is unacceptable. So for our youth, we have seen a pretty consistent decline in youth mental health, and I'll talk a lot about that today. We have 76,000 youth who reported a severe major depressive episode. That average is a little less than the national average, but obviously that is disturbing that we have that many youth reporting a major depressive episode. We know that on average, 1 in 6 children 2 to 8 years old have a diagnosis of a mental health, behavioral, or developmental disorder. That's a lot of kids. And then for ages 10 through 24, we know that suicide is the 3rd leading cause of death for that age group. In the national ranking, it's actually the 2nd leading cause of death in that group. So we have some work to do. As Speaker Ledbetter said, we have a fair amount of work to do. We've been pretty busy building the mental health system, but we absolutely have a lot of work to do. Also did want to talk a little bit about the funding. You heard the speaker ask me, what year was that when you had proration? It's a vivid memory for me. It was 2010. When our general fund appropriation was cut by $43 million in the middle of a budget year, which meant you had to figure out before the end of the year how to come up with $43 million. So that was devastating, and I described the years from 2010 really to 2027 as the dismantling of the mental health system, because honestly, that's what we did. We closed state hospitals, we shrunk our services down pretty significantly. I was the HR director at the time when we made those cuts, and I spent 2 years sitting in front of employees telling them they didn't have a job. So we never want to do proration again if we can help it. But as you can see, beginning in 2017, things began to change. And as you can see from this graph, since 2018, just the increase year over year in the general fund is $102 million. That's a 95% increase in the general fund. Thanks to the governor's commitment, the leadership of Speaker Ledbetter, and the support of the Alabama legislature, we have seen the largest financial commitment to mental health in the state's history. So I think, round of applause. The common unity between the executive branch and the legislative branch on this issue, this mental health issue, is really absolutely changing lives. And if you read the national news, you know that that's not the case in every state. And so I am so proud to serve along with Speaker Ledbetter and so many members of the legislature and the governor, because they are absolutely united on this issue of mental health. So how are we doing with the mental health of our children and youth? Not so great. There are a few things going on in that space, and we do have some exciting projects that we're implementing in the state. But what is it that is actually impacting the mental health of children and youth? Often we think of it as adverse childhood experiences. Often that shows up in the form of trauma. And that is a big part of why we're seeing our children and youth really struggle with mental health issues. So we know the degree to which we can address childhood trauma of any origin determines a child's future mental health and their educational success. So kids really do need to be in a great space in order to learn and in order to be well. Child abuse and neglect is the single most preventable cause of mental illness, the single most common cause of substance use, and a significant contributor to the leading causes of death, such as heart disease and diabetes. Trauma-based behaviors that we see because of these adverse childhood experiences are often misdiagnosed. Kids often get labeled as having ADHD, anxiety, or depression, and the interventions for trauma-based behaviors are very different than the interventions for those issues. We know for sure that if the kids' score on the adverse childhood experiences screening is higher, they're going to have a greater likelihood of experiencing mental health disorders. So what is an adverse childhood experience? I thought we would have a test today because I might be a policy wonk too. So would like to do a screening with you guys. So one of the ways you can figure out whether or not a child has had trauma is really doing a simple 10-question screening about adverse childhood experiences. So as I go through these questions, if you want to think about a child you know, or if you want to do the screening for yourself, just tick off the yes and no's. These are yes or no questions, and you'll come up with your ACEs score. And that really is what we look at with kids. Where are they on the ACEs? How much trauma have they experienced along the way? So question 1, are y'all ready to take the test? All right, yay. I know y'all are. So like my staff is geeking out over here over the screening. All right, question 1, did you feel that you didn't have enough to eat, had to wear dirty clothes, or had no one to protect you or take care of you? Yes or no? Question 2, did you lose a parent through divorce, abandonment, death, or other reasons? We saw kids lost a lot of parents during COVID, or they lost their caregiver. Did you live with anyone who's depressed, mentally ill, or attempted suicide? Did you live with anyone who had a problem with drinking or using drugs, including prescription drugs? Did your parents or adults in your home ever hit, punch, beat, or threaten to harm each other? Did you live with anyone who went to jail or prison? Did a parent or adult in your home ever swear at you, insult you, or put you down? Did a parent or adult in your home ever hit, beat, kick, or physically hurt you in any way? Did you feel that no one in your family loved you or thought you were special? Did you experience any unwanted sexual contact? So the higher the ACEs score, the greater the likelihood that kids are going to experience a mental health or substance use issue. So how do we get ahead of that? How do we figure out a way to address that? Because we know if kids are having those experiences and they wind up in foster care, then by the time they get to foster care, they've already hit almost every one of those questions. And so if the first time we start intervening is when a child is in foster care, then we're already too far behind the curve. So we actually know which kids will struggle by the time they hit first-class pre-K or in a first-class pre-K classroom. We know for kids who are in pre-K, any pre-K classroom, that they are 3.5 times more likely to be suspended or expelled than K through 12 combined. I'm gonna let that sink in for a minute. Why is that? Why do kids get kicked out of pre-K? Behaviors, right? And you don't have to go to pre-K. It's not like the rest of your school years. You're not required to go. So if a kid is acting out in a pre-K classroom, 9 times out of 10, they're going to get kicked out. Those same kids are the same kids that when they reach school age and later in their life drop out of school or have really negative experiences in the educational setting. Those same kids are also 8 times more likely to wind up being incarcerated by the time they get out of school. So we actually know which kids are struggling often by the time they hit pre-K. We know that 90% of brain development's done by age 5. So if we're going to intervene and we're really going to begin to try and help rewire the brain from the trauma kids have experienced, we got to do it, and we got to do it quickly. So here's the good news. So if a child is in a first-class pre-K program in the state of Alabama, the legislature has invested significant funds in first-class pre-K. If that child is in first-class pre-K, they have access to infant early childhood mental health consultation. This is a partnership that we do with the Department of Early Childhood. We put infant and early childhood mental health consultants in all of the first-class pre-K classrooms. We also have them in our PATHS program, which I'll talk about a little later. We have them in the early intervention program, which is birth to 3. And we also have a consultant here at the Lovelady Center in Birmingham. These individuals go out and work with teachers and families to help support them and help them address the behavior challenges that are happening at home or are happening in a classroom situation. And so Alabama is really ahead of the game in this arena. And we have a wonderful partnership with Department of Early Childhood. We have 10 infant and early childhood mental health consultants in the classrooms around the state. And obviously our goal here is to catch that situation early, intervene, and hopefully then that child is able to move on through their educational experience and not have those behaviors showing up in a classroom setting. We also are implementing trauma systems therapy in partnership with Gateway here in Birmingham. We're very excited about this project. This project, once again, is working with kids, especially those who may be in foster care, to help them and their foster parents and everyone around them learn how to address the behaviors and respond appropriately when kids are in fight or flight mode. And really beginning to help rewire their brain through that kind of support. We will be training a lot of folks. Our goal as a department is to take this pilot program and then implement this and make it a part of certification for all the child serving agencies that we have under our umbrella. For the Pediatric Crisis Center, for our programs at Wellstone, for all of our psychiatric residential treatment programs, we want everyone who touches a child to understand when there is trauma present, there is a way to support and react to children that will help them through that trauma. I'm very excited about this project. This is the one I geek out over because you're really talking about making a huge difference. It helps with decreasing the relinquishments from foster care. I mean, there are just so many benefits, and I'm excited for you to hear about it today. You're going to hear about it in the panel discussion in a lot more detail. We also know that pediatricians are really trusted advisors for parents. More often than not, we know that parents are going to be talking to the pediatrician about their child, especially if they're in a mental health crisis. We have data that shows 60% of parents said they would go to their doctor to talk about a teen mental health treatment before they would talk to a mental health provider, a guidance counselor, or a close friend. One of the really exciting projects we've been doing for several years now is pediatric access to telemental health services. Again, this is a partnership. You're hearing me say that a lot. There's very little we do in our department that we don't partner with some other organization that is touching kids in some other space. This partnership is with Children's of Alabama. This program really saved us during COVID. When kids were at home with their parents and they were having a mental health crisis, they could get access to mental health care through telemedicine. This project increases the mental health care by building the capacity of that primary care provider, that pediatrician, to diagnose, treat, and manage mild to moderate behavioral health conditions in children and adolescents. So there's consultation if the pediatrician is seeing something that he's not familiar with, or if the child is on medication and the medication is no longer working, then they can access the wonderful professionals at Children's Hospital, the psychiatrist, the nurse practitioners, and really talk to them about what to do in that situation. There's care coordination that's available. Referrals are often a big part of the program. But in addition to that, the behavioral health services can be offered via telemedicine in the office of the pediatrician or the primary care provider. So in many of our rural communities, and this project really started in our rural communities, that is the only access sometimes they can get. Okay, I do sing, but that wasn't me. Right now, we have 121 primary care practices sites and then 452 individual providers enrolled in this program. It is a phenomenal program, and there's tons of data. If you want to go on the children's website, there's tons of data to back up the effectiveness of the program, and I see some of our folks that work in that program that are here, so glad to see you guys. We also work with State Department of Education for our school-based mental health collaborative. We work with them on the multi-tiered system of support. So there are 3 tiers to that. Tier 1 and Tier 2 are mainly provided by the Alabama Department of Education. And Tier 1 services are those services that are for all kids, all of the prevention activities that you might think about in a school setting. And then Tier 2 is really a more specific intervention. You heard the speaker talk about mental health service coordinators. Speaker Ledbetter was the champion for that program. We didn't have mental health service coordinators until that situation that he described earlier. Now we pretty much have mental health service coordinators in most of our school systems around the state. The Department of Mental Health provides Tier 3 services, so we have a mental health therapist in 115 school systems around the state. We work hand in hand with the mental health service coordinators. We're sort of connected at the hip when it comes to the tiers and how we work together and how we train our staff. And many, many thanks to Dr. Kay Warfield, who does a phenomenal job with that program. We do have additional funding in the budget this year. Our ultimate goal is to have these services in every single school system in the state. But what is really driving this big increase in youth mental health issues? So we've been looking at the data, and as you can see, major depression among teens since 2010. In girls, it's increased 145%. In boys, it's increased 161%. So what in the world is happening with our kids? Maybe you think, well, they know more about mental health these days. They see it a lot. Maybe more kids are identifying as having a mental health issue. But then when you look at the emergency room visits for self-harm, you see a similar pattern. So 188% increase for girls, and then a 48% increase for boys. So we have switched in our society from a play-based childhood to a phone-based childhood. Most of the people sitting in this room, folks my age for sure, when you went out for summer vacation, you went and played with your friends, you went and visited other people. When you went home from school, you were often with your family or playing with other kids, but it has shifted. And it has shifted to a phone-based childhood. So what is the impact of social media and a phone-based childhood on our kids? There are 4 fundamental harms. Social deprivation, so obviously if kids are looking at their phone all the time, they're not relating to others. Sleep deprivation, the screen time is really an issue in terms of good sleep. Attention fragmentation and addiction. Many of the gaming apps that are out there produce the same kind of dopamine response as you would if you took a drink or you took a drug. And they're purposely designed that way. So if you have kids who are doing a lot of gaming, you are putting them at risk of a future addiction. The amount of time that we spend with friends is decreasing. If you look at the chart from 2003 to 2019, it went down drastically for age 15 to 24, 25 to 34, and yes, all of us are spending less time with friends. That's an issue for your mental health. Connectedness and relationships are the most important thing you can do for your mental health. And so anytime we are decreasing in that area, we're putting our mental health at risk. So, how is it impacting? Adolescents who spend more than 3 hours a day on social media face double the risk of anxiety and depression symptoms. And right now, as the summer of 2023, the average daily use was 4.8 hours. Adolescent social media use is predictive of subsequent decrease in life satisfaction for certain developmental ages and stages. Girls are at greatest risk at age 11 to 13. Boys' greatest risk is 14 to 15. So what can we do? This is out of a book. If you haven't, how many of you heard about the anxious generation? Yay! Yay! Put it on your reading list if you don't have it. Most of this data about phone-based childhood came from from that publication. So what can we do? No smartphones before high school. So you can't have a flip phone. If you need, you know, some of my people don't know what flip phones are, but I might have a really young staff. You don't, do you, Collier? Okay. No social media before age 16. Phone-free schools. So another part of the discussion today on the panel will be your policymakers considering a bill that would limit phone usage in the educational setting. So that'll be a great, I can't wait for that topic. More independence, free play, and responsibility in the real world. So getting kids out, engaged, and in the community really can build that resiliency that we look for in kids. So sometimes you can't do anything about a child losing a parent. There's some things that you can't do anything about. You can do some things to build resiliency. And as I told a committee last week, there was a hearing on this phone bill, and I'm like, rarely do I stand in front of you and say, by the stroke of a pen and a passing of the bill, you can improve the mental health of kids. But if that bill passes, it will absolutely decrease the amount of phone time. So, what is the solution to this mental health crisis? Connectedness really is a big, big part of it. So no matter how great your ed policy is, we can't expect our children to thrive in the classroom when they are dealing with unmet mental health needs, trauma, homelessness, and hunger. Those students who arrive in that stressful state when they're in the fight or flight mode don't internalize new information at the same rate as children who enter the classroom in a calm state. So if you've got a kid coming in who's really anxious because of what just happened at home, their brain is not going to be able to calm down immediately in order to learn new information. The problem with that is year after year, those same traumatized students learn at a slower and slower rate because they have trouble hanging on to that new information. But here's what I'll tell you. The school environment can be a great place to rewire the brain from toxic stress and trauma. There is so much about the school environment that is supportive. There is so much that can be done through school culture. It is amazing. So my ACEs score is an 8. I missed a couple of the things, and as you know, you don't want to have a high score on the ACEs, right? But I have a high score. But school is my safe place. I love learning. I might have often been the teacher's pet because I love learning. But there were so many people in that school environment that really made such an impact. It's the coaches, like your son. It's, you know, my 5th grade teacher named Miss Rutledge. It's all of the people in that environment. So what I want you to hear today is you really can make a difference. You can help kids who are really struggling by getting engaged with them. And so what do we need to do? We need to address the cell phones in schools, which is going to happen. Policymakers are on that. We need to develop strong connections through sports, music, singing, and other activities that help rewire the brain. You know, grab a kid and take them to a concert. There are things that build resiliency that are simple things. You can't do anything about what's happened to them at home, but you can get engaged with them and get them into sports and other things and get them engaged in school. All right. So we have been designing and delivering effective care. You know, we've been rebuilding the system. So as you saw through the budget cuts, we really pretty much dismantled our whole system. And then we began the conversations about, okay, we need additional resources, but what do we do with those resources? And we really began to design absolutely new services that we had never had in the state before. And we set a plan in place, 5-year goals. We want to implement crisis services in all 67 counties, convert the public mental health system to CCBHC, which is an integrated care model, and increase civil commitment beds to 30 per 100,000 Alabama residents. Civil commitment beds are for those individuals who are a danger to themselves or others and refuse to go to treatment other than through a probate commitment. When that $40 million cut happened, we shut down a significant number of civil commitment beds around our state, and we are now playing a wicked game of catch-up to try and address that issue. So some really good news about crisis services. So as you saw on the graph, the money increased, and so what in the world did we do with it? We set up crisis centers around the state. We have crisis centers in Huntsville, Birmingham, Tuscaloosa, Montgomery, Dothan, and Mobile. Those crisis centers, most of them have been operating since May. 3 of them have been operating since May of 2021. You'll hear from Jeremy Blair from Wellstone, who opened one of the very first crisis centers in our state. He's going to be on the panel this afternoon. In that time, we have served over 16,000 individuals in our crisis centers. And really, this past year, we served 8,000 of those. So we actually managed to double the number of people we were serving in our crisis centers this year. So thank you, Jeremy, and the many folks who are sitting over here who made that happen. We had two goals with crisis centers, to keep individuals with mental illness out of jails and out of emergency departments. We needed a part of our system where if you were in a mental health crisis, you could get to services 24/7. And so crisis centers provide an extensive assessment. They provide temporary observation, which is 23 hours in a day. And they provide extended observation, which is 5 to 7 day crisis stabilization. So this is literally a place you can go if you're in a mental health crisis, get assessed, really thorough evaluation, and if need be, stay there for 5 to 7 days. The presenting symptoms were a surprise to us sometimes. So over 2,700 people showed up at a crisis center who were considering suicide. So I don't think it's an exaggeration to say that that's 27,000 or 2,700 lives saved. So it makes me want to cry every time I look at the number, because we worked so hard to get these crisis centers up and running. What we've seen is an increase in the number of people showing up at crisis centers who have a substance use disorder. So if you compare that to last year as a presenting symptom, that number would have been lower. And we're really excited about that because you don't have to sort out if it's a mental health issue or a substance use issue. You can show up and you're going to get services. Over 12,000 people avoided an emergency admission, and 2,700 or so avoided jail admission. And then we had 1,200 law enforcement drop-offs, where instead of having to take you to jail because you had a mental health issue, because that was the only choice available, they dropped them off at a crisis center so they could receive services. Another component that you'll hear about today as well is mobile crisis teams. So we do have teams of people. If someone is in a crisis and you call our 988 number, they can be deployed out in a community so that in communities where transportation is an issue, really in our rural communities, this is a model that works really well. In our mobile crisis teams, we've served over 8,000 individuals, and we've also served 1,100 children in mobile crisis teams as well. The thread that pulls all of that together is an easy-to-remember 3-digit number known as 988. So now in our state, you don't have to figure out which mental health center you need to go to, what number to call. You simply can dial 988 and get access to the Alabama Crisis System of Care anytime, day or night. How many of you have heard of 988? Yay! Okay, I know. Like y'all came because you were interested in mental health, so yeah, okay. Yeah, so 988 has been phenomenal. You know, before this, if you were in a mental health crisis, more often than not, the number you were going to call is 911. And if you dialed 911, you were either going to get law enforcement or EMS or sometimes both. And before we stood up crisis centers, the only two places they could take you is jail or the ER. And so having an easy to remember 3-digit number that you can call in a mental health crisis has been a huge game changer. When we stood it up, we had no idea how many calls and how many contacts we would get. But as you can see, we're over 114,000 contacts at this point, and the line's been operating since July of 2022. Here in Birmingham, that is a partnership with a crisis center of Birmingham, the organization that's been around for a really long time, the United Way agency known as the Crisis Center. JBS, that is our mental health center, partnered with the crisis center in this area to stand up the crisis line known as 988. So all of the services that I just talked about for crisis services are for people who will willingly go to treatment. So a lot of times folks get in a mental health crisis, they're really seeking out treatment, they really want to go. Sometimes if people are more severely mentally ill, they are not wanting to go to treatment, and if they become a danger to themselves or others, We call that involuntary beds or civil commitment beds. So this graph shows you the new beds that we've done with the crisis centers, which is 145 right now. And Melissa, I can't remember if that includes Spectra Care or not. Okay, that's okay. It's okay. Yeah, so we actually have more beds than that because we just opened Spectra Care in Dothan. As you can see on the other side of the screen, we have 687 beds in our state. That's not enough civil commitment beds for our state. We recently looked at the treatment advocacy center numbers, and what we should have in our state is 30 per 100,000 civil commitment beds. We're at about 14 or so right now statewide, but this graph shows you in our 5 regions where we are with trying to get to 30 per 100,000 civil commitment beds. Region 1 is at 8.8, which is a very low number. Region 2 is at 11, Region 3 is at 14, Region 4 is at 14.8. And so a big part of our conversation in the legislative session this year was really around trying to get to that number of civil commitment beds or beginning to develop a 5-year plan that would get us to that number. That's the rebuilding from the devastation of a $40 million cut to the budget. And we're very excited about it. We're already have some plans for Region 1 that we're working on, and excited to get that work started. We are also shifting as an organization to an integrated care model. So we have 19 community mental health centers around the state. If you work for a community mental health center or you're the executive director of a community mental health center, would you please stand up? I think we have quite a few in the room. So we really are redesigning and redeveloping every aspect of our continuum of care. And this model really is a national model. We're in a demonstration grant right now with our federal partners, SAMHSA and CMS, to implement certified community behavioral health clinics across the state. If you notice the green circle, that's crisis services. We knew we wanted to go to an integrated care model, but what we needed in our state was crisis services. And so the investment that has been made in crisis services really allowed us to begin to transform our whole system into an integrated care model that is much more efficient. The rate structure is a much better rate structure, and the integration of the services will mean much improved outcomes for the people we serve. One of the most exciting things for me is getting to same-day service. So no matter if you're coming in for an outpatient appointment, no matter what you're coming in for, our mental health centers will be working towards trying to get to same-day service. That's just one of the many exciting things about the integrated care model. And that's just a little more if y'all want to look up more about CCBHC, but we are really, really excited. So what are the takeaways? What are the really important things that we can talk about today? The reality is right now we are raising children and youth in an environment that is relationally impoverished and sensory overloaded. What we need to do is put the phone down. We need to put the phone down first, right? So that we can model that behavior for kids. We need to help our grandkids and our kids put the phone down. Relationships are important. Whether it's policymakers, you've heard it today, nothing in this presentation would have ever happened without those relationships. The nature and quality of our relationships are at the heart of good mental health. We now have the brain science to show disconnection and loneliness play a major role in mental health. We have the brain science to show that kids are not simply acting out because they're undisciplined or have bad character. they're acting out because they're traumatized, and we need to figure out how to help them through that. Alabama is making significant progress in early intervention and access to care. And none of this would be possible without the common unity of the policymakers in the room and their commitment to make a difference for the citizens of Alabama. And I feel very, very fortunate to be the commissioner of the Alabama Department of Mental Health and working with the policy leaders that are so committed to addressing this issue. Thank you. Okay.